Hi guys, welcome back to my channel. My name is Dr. Jaime Canada. I'm a pelvic floor physical therapist and I'm excited to be back with you all today to talk about overactive bladder and urinary urge incontinence. So if you're someone who you're going to the bathroom countless times per day, possibly multiple times a night, you're always looking where the next restroom will be when you're out in public, and you might even avoid doing social things because you're nervous about having to use the bathroom so much or having leakage when you feel an urge to go to the bathroom. If the lighting looks a little different, this clip is put into the video to make sure I don't forget to mention that this is part of my Better Bladder Series. So today I'll be talking about what overactive bladder and urge urinary incontinence is, and then in future videos I'll discuss more about treatment options, evaluation, etc. So when we talk about overactive bladder, this is going to be an involuntary contraction of the detrusor muscle, so the bladder, and this can occur for multiple different reasons. Typically our nerve signals to the brain become disrupted, causing spasms, but also this can be due to different neurological disorders as well as dietary triggers such as caffeine, spicy foods, carbonated beverages, and also just learning poor habits such as going to the bathroom just in case, or getting used to going to the bathroom every time you go somewhere and not letting your bladder fully fill to empty. Some people may have that urge to go with leakage, which is due to when we have the involuntary contractions, the bladder pressure, it's more than the sphincters or seals can handle. So when that pressure overrides the ability for sphincters to remain closed, that's when we get leakage. Leaking urine does not always depend on how much volume of liquid is in the bladder. This is why many people will leak urine and not make it to the bathroom in time. Women rarely have enough warning to make it to the restroom when this happens, and it does not depend on how much liquid is in the bladder. So some people may have full bladders, but some may over time have developed a disrupted voiding schedule where their new normal that their bladder senses is, let's say, halfway full. And so every time they are having that urge only halfway full, the combination of frequent urge as well as increased pressure overriding those sphincters will lead to leakage. The good news is there's a lot we can do in pelvic PT to treat overactive bladder and urge urinary incontinence. Some of the things I like to do with patients are bladder diaries. I could make a separate video on this, but the idea is you're tracking for however much time, could be, let's say, couple days during the week and a weekend day, tracking what your intake is and fluid, what kind of foods, are you getting an urge to go to the bathroom, and how much urine when you did go to the bathroom were you voiding, and then were you leaking at this time. And so we'll look for trends to see what could be causing some of this disrupted pattern, as well as teaching you urge suppression techniques. Once again, I can make a video specifically on that, the different things to do. For example, every time you get the urge to go to the bathroom, counting backwards from 10, thinking about, let's write out our grocery list, trying to maybe not brush our teeth before we go to the bathroom in the morning. So people have different triggers, so identifying that is also another technique. but also looking at, are there any particular factors from pelvic floor musculature? So whether that is tightness, which is not allowing our pelvic floor to contract and relax fully, leading to frequent spasm and leakage. Could also be leakage due to weakness of pelvic floor. Lots of different factors. So it's important that if you do have the ability to see a PT in person, that they can do a thorough examination to see exactly what's going on. So let's say you do have more of the weakness symptoms going on, that could be where we have you do more of the pelvic floor contractions, working on strength and endurance. Other things can be coordination, such as biofeedback, manual therapy to those pelvic floor muscles, or to abdominal wall if we're finding more restriction in muscles that kind of are near the bladder. Lots of different things that we'll look for. So be sure, if you have the ability to see someone in person, do it. But if you are experiencing these symptoms, just know that there are ways that we can improve and sometimes eliminate them altogether. If over time you're finding, hey, this isn't helping as much as I'd like, there are other things such as more invasive procedures or medications that can be prescribed to help with overactive bladder and urgent incontinence as well. So thanks so much for watching. Hopefully this was insightful, and if you feel like you are someone that can relate to a lot of what I was saying, I'll be sure to make videos on, and I'll attach here at the end how to do a bladder diary, as well as some urge suppression techniques. So be sure to subscribe, turn on your notifications for my future videos, and I hope you enjoyed. I'll see you soon. Bye.